I thought we'd talk about autism and complex PTSD and PTSD. There's a considerable amount of research that says that children who experience maltreatment in childhood, things like eggshell parents, narcissistic parents, immature parents, mentally, physically, and or emotionally unsafe experiences, often have similar brain differences and challenges and changes similar to children who also have autism. Say that again. Similar to the brain differences we see in autism. I want to read this to you. It says, in their extensive review, this study concluded that early life stressors, in particular childhood maltreatment, is also associated with significant brain change in adults, particularly in the hippocampus, corpus callosum, insula, dorsolateral prefrontal cortex, often called the PFC, the orbitofrontal cortex, the anterior cingulate gyrus, and the caudate nucleus. Each of these areas has also been implicated in the brain differences we see in autism. Functional connectivity of the amygdala, the fear center of the brain, and the PFC have been found in both autistic children and in traumatized children. So this is our baseline. We're talking about the fact that this is where we're at right now. We are at the beginning of understanding this dynamic of autism. I think that it is important to hold space for the fact that there is so much we still don't know, that we've done a lot of research on trauma, but not everything is about trauma in terms of understanding the additional challenges people might face. That people with autism, to have autism, is to almost inherently have some forms of relational, diffuse, complex trauma and or PTSD. And so I'm going to try to make this video short. It's gone longer and I've been remaking it multiple times, but I can save you this part and say if you think you have complex trauma and you think you have autistic traits and or autism, you probably have both for many reasons. So what we're going to do is we're going to talk about, as much as I can without this being 6 hours long, the core differences first, because there aren't that many, but they are important. And then the significant overlap between complex PTSD and autism. As I said earlier, I forgot to say this, but this is really important. There was a time, and if you read the book Neurotribes, which I highly recommend, there was a time when we just said that bad mothering caused autism. And that was the belief among very educated people in large part. So it's really important that you don't hold any one of us up to anything, like they're saying one thing so it's all true, that we hold space that we don't yet know a lot. I might come back in a year and say, oh, that was wrong, right? We don't know, but we don't know. So to say it's dangerous to talk about this, to say whatever, it's sort of a joke. It's like there aren't that many resources for people with autism anyway. I think that the removal of Asperger's as a term, I understand why for so many reasons, but it's easier for people. If I made a video and I said, oh, I have Asperger's and complex trauma, I think that because of the lack of awareness and understanding and education, that would be received differently, for example, than something like autism and complex PTSD. So there's all these nuances and words and changes and things we're realizing that we just didn't know. And that's really important. But to hold that if the brain changes, the neurodivergencies of trauma and childhood trauma and autism are similar, right there we've got an issue, right? And the core of those, I really believe, goes to, it seems like the biggest piece is the nervous system for both of them. And that's in part why a lot of trauma treatments can be helpful for those with autism. The problem is there are places where it's not going to work enough. So things like grounding, really helpful, but other parts we might get some trauma worked through, but not understand the underlying pieces. So let's get into it. The first thing to understand is that, really quickly, complex trauma and PTSD are acquired. They happen to you. You are not born with them. Autism, you're born with. And if you look around your family, it's probably likely that someone in your family, your kids, your parents, your siblings, your aunts, your uncles, you go, We have some similarities there. It's much more likely in your family system. Doesn't mean that it necessarily is, but it's more likely. So one is happening and is acquired, and one is happening as a result of sort of the way that everything kind of came together in the womb. And then perhaps the way it expresses itself can change based on your environment and things like that. Or the parenting, of course, can affect how those things play out. Safe environments, not safe environments, but the core piece is already there. So I want to talk first about some core pieces of autism that can express themselves in maybe some flavors of complex trauma, but that are very much the hallmark of autism. Number one, repetitive and self-soothing behaviors through the use of routines. So a lot of repetition, a lot of routinized life and schedules and systems. There's a safety in that. There's a reliance upon that. Now, if you happen to have ADHD, that can be another piece of this, also very common with autism. We're not going to discuss that today, so let's pretend that doesn't exist, but that can interfere with that need to have routine. But this can look like, stimming, although anybody can stim, but stimming can provide a source of not only pleasure, but also of regulation. But a lot of that repetitive behavior, whether it's thoughts, behavior, patterns, whatever it is, there's a self-soothing to that is very grounding to the nervous system for those with autism. Number two, difficulty intuitively reading neurotypical cues, so cues that the neurotypical world sets up. And I also believe that as opposed to complex trauma, part of the problem with autism is that it's not just like a fear of rejection or shame or being like not accepted, which can be a huge part of the trauma personality. It is that everything is an issue. What you say, do you share, overshare, undershare, the smell, the lights, the sound, taking everything in, what face are you making? How do you respond to those things? Did you say too much? The anxiety, it is everything for that. When I think about the differences, it's like with complex trauma, maybe someone's afraid of being rejected or, having that narrative reinforced in their childhood. Where for me, at times, like, I don't really care what you think of me, but the whole thing is freaking stressful. What you're saying, what I'm supposed to say, where I stand, how long do I stay? God, that table over there with the appetizer smells disgusting. Like, I'm not eating that food. I never eat buffet food. Like, it's so many things. Okay, we're going to come back to that. Actually, that leads me to the next piece, which is sensory sensitivities, which are also common in trauma, but these are your baseline, right? So I believe if you have autistic traits, you have a lot of sensory triggers. Now, maybe they're not all the same, right? They can be very different, and one can be stronger than another, but you have this profile of sensory sensitivities, and it's smell and texture and taste. It's everything, right? It's sound. It's everything. And we'll come back to that. But it's part of your baseline. You were always that way. And that affects things like how you regulate your mood, right? If you're triggered in your sensory issues, it's really hard to regulate. And then lastly, special interests are often very common for those with autism. Now, let's just say you have PTSD or CPTSD. You're going to have a traumatic event. You do not need a traumatic event in autism. You're going to have avoidance behaviors, right? Especially around things that trigger the trauma. So with autism, you might have lots of things you avoid that trigger intrusive thoughts or difficulty managing things or dysregulation, but it's not necessarily focused on something like avoiding trauma-related triggers. Number three, intrusive memories and flashbacks mostly related to the trauma. Those with autism can have a lot of intrusive thoughts about all kinds of things, not just trauma related, not just, I could drive my car that way, but I wonder what that means. And then that leads you to the next thing. And next thing you know, your brain's down a rabbit hole. There's all kinds of thoughts that are happening at once. But around the PTSD experience or CPTSD experience, there can be sensory, emotional, or physical, visual flashbacks. Of course, if you have trauma and autism, you can have these too, but we're acting like they're separate for now, okay? Hypervigilance, very common in both, right? But when you have a trauma, you've learned to scan in hypervigilance, that fight or flight, for safety again and again and again. And so your nervous system is in that state a lot of the time, but maybe not all of the time in the same way or around the same triggers or issues. Whereas with autism, you have this almost chronic state often of hyperarousal, hypervigilance. It's like always happening in there, even if it doesn't appear so on the outside and you've learned to fake it. And lastly, nightmares. Now, sleep issues are a huge problem in autism, but nightmares specifically around the trauma or related events are going to be much more common with complex trauma or trauma, PTSD. Okay, so that's the core difference, right? And even though I was still saying that, I was still sharing the similarities. Let's talk about the overlap. It is significant. Dissociation, right? So for trauma, we're trying to manage where our trauma responses. A lot is happening in the purpose of dissociation. For autism, we can be doing the same thing because we may have trauma, but also our brains can have different thoughts, different parts of ourselves are going other places for different reasons, in response to our sensory profile, in response to the social issues, in response to our own stories. It's common. Intimacy difficulties, number 2. Obviously, with autism, as I made a video a few weeks ago, I believe that the process of not just communication and connection and all the things required to be in a relationship, but your sensory issues can be a huge problem in intimacy. The saliva, the smell, the sounds, the taste of being intimate can be very, very triggering. And we've learned to push through that and mask through that, but it can be at the core very dysregulating. And for someone with trauma, if they're having difficulty with intimacy, it might be around like safety with their body or trusting people. Of course, they can also have sensitivities with sensory issues, but it's more about the maybe once safe state and now not safe state, if that makes sense. So I don't think you're going to see it to the same intensity and degree as you might with autism. Number 3, increased risk of victimization. So we know that those with autism are at a much higher risk, as are those with trauma for many reasons. Negative beliefs about the self and the world. And of course, if you've had a violation of trust and a repeated dynamic at home with maltreatment, you're going to feel bad about yourself. That's the core, right? I'm bad. There's something wrong with me. And also with autism, if you've had that, the world hasn't responded to you well, you've been punished for it, bullied, victimized, and or you have a lot of often rumination and overwhelming, like you're often aware of what's happening isn't going well, but you can't stop that. And so between experiences and the way your brain works, there can be a deep flawed sense of self for both of them, but for different reasons. A heightened sensitivity to sensory input. So with trauma, of course, you're going to have, like I'm talking about, especially trauma-related sensory issues. But with autism, your baseline is going to be always sensitive. And maybe it's hyperactivated by certain experiences, but at the core, that's what it is. High rates of substance abuse, depression, and self-wounding for both are very common. And I think the core of this is about the nervous system dysregulation for both and trying to manage. Hypervigilance, overactive nervous systems, heightened startle response, all of that makes sense, right? Except for the person with autism, I would say, is born with, more likely, a dysregulation to occur much more frequently. In the podcast, I'm going to link down below that was very helpful, and there's really great visuals from Dr. Megan Neff. She provides this example of a study where they gave shots to autistic kids and non-autistic kids. And they found that it took the autistic kids longer to kind of like get back to regulation after the discomfort, trauma, whatever, of getting a shot. But that even when autistic kids looked like they were fine, they were still dysregulated. And I think she calls that, reference to some researcher, faux regulation, which makes me think a lot about avoidant attachment. But this idea that you've learned to put on the face that you're fine, but inside you are just massively anxious, dysregulated, whatever. So at the core, but with a trauma, you're going to have, you develop this. And of course, you're more, now that you've had bad things happen or whatever, you're going to be more responsive. Impulse control difficulties for both, for different reasons, but also similar to that brain in the beginning I was talking about, the brain changes. Same thing goes for executive functioning, same dynamics. Sleep issues for different reasons in trauma and autism, and stimming. As I said, stimming can have lots of reasons why we do it, but in autism, it really provides not only pleasure, but also a way to regulate. But that'd be true potentially for those with trauma. So those are what make it complicated. And it also means that what I found is that To have autism and then trauma means that the way trauma expresses itself can look different for you, that trauma can exacerbate underlying autistic traits like rumination, regression of skills, communication, as well as stereotyped behaviors and speech, and that we can see a lot more rumination in autism when we have trauma. So if you think about if you come into the world with a heightened sensory response, right, and you have a predisposition to ruminate, to think through things, to overthink, and you have a trauma, you're sort of set up to have the trauma be more impactful. And in fact, some research shows that for autistic people, even social situations can actually be traumatic, but that's not part of the DSM criteria. And depending upon which research you look at, in some cases more for women, to have social traumas makes a lot of sense. But that for many people with autism, that social dynamics can be traumatic for them. So we're looking at things like 70% of those with autism also have a co-occurring mental health issue, things like anxiety, depression, OCD, and that up to 60% of those with autism have experienced PTSD in some form compared to the general population. So what that also means is that just because you have a trauma, if you don't have autism, really anything, for example, it doesn't mean you're going to have PTSD. In fact, most people don't go on to have PTSD. They have the trauma, they work through it. But if you have autism and you have a trauma, you are much more likely, up to 60%, 30 to 60%, to have PTSD-like symptoms. So at the core, we have this overactive amygdala, this fire alarm part of our brains in both trauma and autism. We have a lot of hyperarousal. And one study said that for people with more autistic traits, they often display a specific form, a certain flavor of PTSD that is characterized by hyperarousal, more startle responses, more insomnia, and they're more predisposed to anger and anxiety and or issues with concentration. So the core of this is that with autism, we're encoding things more, we're responding more with our brains, and it's making us more likely, more vulnerable to have trauma. The last thing I want to share is something I found too, which I think is what my whole goal of this is, to make it in some ways probably more confusing, but to stop forcing you to just like really only decide is it one or the other, but to perhaps look at those more nuanced things around autism to start to differentiate. Because it does make a difference, and the problem is a lot of therapists don't understand autism, myself until this last year included, especially high masking. And if you don't really understand it, I think you can really miss out on helping people and you can misdiagnose them for sure. That's a different video. But some research shows that autistic people find certain things more traumatic than non-autistic people. For example, abandonment by someone or the loss of a pet, sensory experiences like a fire alarm actually going off, transitions and changes, so things like school transitions, routine changes in the seasons, unpredictability in day-to-day life, and I would argue things like moves. I've always said that I think the most traumatic thing for my kids through my divorce was the moving and the changing. And in some ways, I think that did more damage. And now I'm starting to wonder, because of my profile, in which flavors and which parts of them and which of them may have been more impacted. Social difficulties and confusion. So difficulties interpreting social cues and misunderstanding. Maybe you misunderstood something and you were embarrassed. I'm not going to share it here, but I've had 3 very distinct experiences where I felt like I was misunderstood and punished for those things as a child and as an adult, for things I thought I was just being like normal about. And not until I went through this research have I been like, oh my God, what if that's what it was? I don't know. But they were all traumatic events in different ways. 2 of them were traumatic. One was just like, I still think about it a lot. I wouldn't call it traumatic. And then events related to one's own mental health. So having like a psychotic break, severe mental health issues, all can cause trauma. And that autistic people may be more likely to find these experiences traumatic due to traits such as sensory sensitivities, communication and interaction difficulties, distress around routine changes, and distress if they're prevented from taking part in repetitive and restrictive behaviors such as stimming. So stimming can help us work through some things. And so the core of this is this. Some theories suggest that other factors associated with being autistic may mean an increased risk of developing or maintaining PTSD symptoms, such as neurological and genetic factors, detailed focused processing. In other words, a tendency to focus on the details, very common in autism, to get hyper-focused and not see the big picture. Increased rumination, so you can't stop thinking about your negative feelings and the events and thoughts. Being more inflexible in your thinking and avoidance. And emotion regulation difficulties. So I think the challenge is that I know this probably doesn't help in some ways. Oh, one of my dogs is getting fussy. I'm going to wrap this up. Is to understand, I just spilled my coffee. There we go with my proprioception issues, always dropping or spilling something. I didn't even get into that one. But the core of that is that these issues are difficult and we have to hold space, like I said in the beginning, for what we don't know. But if you're questioning it, I'm going to just go back and say, look at your baseline. If you're saying, I know I have complex trauma or trauma, I'm not sure about autism, spend some time researching your history of sensitivity around your sensory issues. Look at your communication and social dynamics historically. Look at your repetitive behaviors and how you might self-soothe through routines, because that's where I think it gets difficult. I think many of us go, yes, get the CPTSD, trauma makes sense, I get it, but we're like, oh, I don't know about this other piece. And that is why I went on this deep dive. And as I've been saying, I think my experience is pretty typical. I'm going to slow down. I think my experience is pretty typical. I had a client say to me a couple months ago, oh, I found your TikTok. I didn't know you were autistic. And I was like, I'm not autistic. What do you mean? And that was my first thought, because I don't know that yet. I'm still at the place where I'm researching and understanding and making space and learning. And I think it, as I was saying, is typical to start to have this thing in your brain going off and to be like, I don't know if that's what it is, but I know it's not that, right? And it explains so much. I think last thing I'll say is that I just think that because of the language that we're evolving with autism, I think if there was a word for high masking that felt like it, and I know there's arguments for why not to do this, because you're not a little bit autistic, you are or you aren't. But I think that it gets the language because people aren't educated enough, and we still don't know, and I am like stuttering right now. We still don't know enough that it's making it difficult for those of us to say, oh yeah, that's all true too. But I have to say that there is nothing in any of that when I talk about autism that doesn't feel true for me. And when I look around in my immediate family, I see it. I do see it. And once you see it, you can't unsee it. So that's a different story. But I hope this helps for you. I hope it really does, because I think that it's so confusing and so overwhelming. And at the same time, it's important because if you know that there are some core parts of yourself that you believe are autistic, there are some therapies and things that are not going to help you. There are some things that will make you feel bad about yourself that you cannot control. For example, like rage responses to sensory triggers. For me, it is a huge one, and it is very disruptive. It determines where I go, what I do, how I respond, my sensory issues as much as everything else. And it's been incredibly validating to understand. So I know I had to leave some stuff off. I'll make some more videos on this topic, but because I made that video last weekend and it seemed like many of you really resonated with it, and so many comments are about, okay, I get all this. I feel like this could be autism, but I also have trauma. I really wanted to kind of really focus on the overlap, but also direct you where to go if you're not quite sure still. So, and last thing I'll say is that a diagnosis you want to research. In many places, it may not be helpful. There aren't resources. It could be a negative impact in your life. In many places, it could be a positive impact. So it's not just like, oh, I think I have this. Should I get diagnosed? You should really research where you live and where you are, whether or not a diagnosis will benefit you. And then what are the things, that's my next hopeful goals in this year, to say, okay, I don't know that I need a formal diagnosis, but I need some help with these things. What helps, what doesn't? That's my goal. And I'm going to end this video by saying that If you have one or the other or both, that grounding techniques, things that help you get that nervous system regulated, polyvagal techniques, nervous system regulation, somatic therapies, very, very helpful. I just got a new workbook on somatic interventions. And so I'm still reading about it, but I will share more and more of that. And the last thing I will say is that I am going to be publishing, hopefully, a course on eggshell parenting, on childhood maltreatment, specifically around mentally, physically unsafe parents who you could not predict, who you walked on eggshells with. And I'm going to add a section in the course, or at least 1 or 2 lessons. What do you do if you also believe you had autism and you have these kind of parents? Because I think that is incredibly important to understand. So that's it. Please stay safe and well. And I thank you so, so much for your time and thoughts here. Take care and have a good day. All right, bye.